Every year, thousands of puppies die from a virus smaller than a grain of dust, Canine Parvovirus. In today's video, we'll simplify its pathogenesis, clinical signs, and control, so you never forget this deadly pathogen again. Let's dive in. Part 1. The virus basics. Canine Parvovirus, or CPV2, is a non-enveloped single-stranded DNA virus from the Parvoviridae family. It's extremely resistant to heat, pH changes, and disinfectants. That's why it can survive for months in the environment, even after cleaning. The virus mainly infects rapidly dividing cells, and that's the key to understanding its pathogenesis. Part 2. Pathogenesis. Let's trace what happens inside the body. Entry and initial infection. Puppies usually ingest the virus through contaminated feces or fomites, food bowls, shoes, or hands. The virus enters through the oral route and first multiplies in the lymphoid tissue of the oral pharynx, especially in the tonsils. The viremia phase. Within 2 to 5 days, the virus spreads through the bloodstream. This is viremia. Now, it targets cells that are rapidly dividing. In young puppies, these are found in the intestinal crypts, bone marrow, and lymphoid organs. Intestinal damage. The virus infects and destroys the crypt epithelial cells of the small intestine. Without new cell replacement, the intestinal villi collapse, causing hemorrhagic enteritis, dehydration, and sepsis. This is why affected dogs have bloody diarrhea and a foul odor. It's due to necrosis and bacterial invasion. Bone marrow suppression. At the same time, destruction of bone marrow cells causes leukopenia, making the puppy more prone to secondary bacterial infections. Myocarditis. In pups under 8 weeks, the virus can infect myocardial cells, leading to acute heart failure or sudden death. So, the main lesions you'll see are necrosis of intestinal crypts, shortened villi, lymphoid depletion, and, in neonates, myocardial necrosis. Part 3. Clinical signs. Clinically, you'll see depression and anorexia, vomiting, severe bloody diarrhea, dehydration, and leukopenia. Without prompt treatment, mortality can reach up to 90% in unvaccinated puppies. Part 4. Control and prevention. Now the good news is, it's preventable. Vaccination. Start at 6 to 8 weeks of age, repeat every 3 to 4 weeks, until 16 weeks, then booster at 1 year and every 3 years thereafter. Hygiene and disinfection. Use 1% sodium hypochlorite, that's bleach, to kill the virus on most surfaces. Isolation. Separate infected and unvaccinated dogs immediately to prevent spread. Supportive therapy. There is no specific antiviral. Treatment mainly focuses on IV fluids, antibiotics, antiemetics, and nutritional support to prevent dehydration and sepsis. Once recovered, dogs usually develop long-lasting immunity. So remember, Canine Parvovirus destroys dividing cells, mainly intestinal crypts and the bone marrow, leading to hemorrhagic enteritis and leukopenia. Prevention is through vaccination and hygiene, which is the best control measure. If this video helped you understand CPV better, don't forget to like, subscribe, and share it with your fellow vet students. See you in the next video.